We go on to our next speaker, Dr. Suven Bhattacharjee, who's a consultant of 9 Eye Center and MedInvent Devices. And we know that he's truly an innovator and unimaginable levels his B.Hex ring has gained popularity. So I felt he should be just the person who has to just tell us in 4 minutes the steps for easy insertion of a B.Hex ring. On to you, Dr. Suven.
Yeah, thank you, Dr. Chitra, for this opportunity. And so I'll be speaking on the B.Hex Pupil Expander, the steps for easy insertion. I do have financial interest as an inventor and owner director of the company. And I thank Dr. Deepak Magur and Zain Khatib for sharing their videos. So the first step that I would like to emphasize is to differentiate between an elastic and a non-elastic pupil. So elastic pupil is like a rubber band, where a non-elastic pupil is like a string. So you need two Kuglen hooks to tear them. Otherwise, you won't get past it. And the next is where to inject viscoelastic. So if you inject viscoelastics onto the iris, it plasters the iris onto the pupil, onto the lens, and that doesn't leave space for the pupil expander. Instead, if you inject viscoelastic under the pupil margin and you lift it off a little, you have enough space for the pupil expander. So you keep the anterior chamber underfilled and you inject viscoelastic under the pupil margin. Now we could check the elasticity of the pupil before starting by just injecting BSS through the paracentesis, and you can see the pupil momentarily expands. And that is enough evidence that the pupil is elastic. Whereas in a rigid pupil, you see how much ever you inject over here, the pupil is not going to expand, and it is you need two Kuglen hooks to kind of tear that fibrotic ring, and then you have a reasonable size pupil to go ahead and put your device. So these are the few steps. So inject viscoelastic under the pupil margin and lift it off a little. And then we put a blob of viscoelastic on the device so that it doesn't jump out. And then we tuck alternate flanges under the pupil margin. You've already created space, so it's not difficult. And that is very easy. So you have a nice hexagonal pupil. Then the rest of the steps of capsulorhexis and phacoemulsification are routine. And this allows you enough visualization a little. And there you are. Only while placing the IOL, we need to be careful that we place the trailing haptic into the bag without displacing the device. Now, the easiest way to remove is this: hold a flange, advance it centrally, and disengage it to the two notches on either side, and then draw out the device. If it's a rigid pupil, like here, this is Deepak Magur's video, you can stretch it a little, and that makes your job of tucking the flanges much easier, and you have a good sized expansion for you to go ahead and perform the surgery. Now, you can even stretch after in a partially engaged B.Hex. Now, you can see there are two flanges which are engaged, and I felt that this would be a little tight. So I went ahead and stretched this, and now I'm going to be able to put the third flange very comfortably. And that will offer a very good size of the pupil for me. Now, this is a situation where the three flanges are already tucked and it was a rigid pupil. So this is buckled a little. So you could even stretch over with all three flanges engaged, and you can have a well-sized pupil. Now, removal of the B.Hex is, this is the wonderful part of it. You can remove it through a 1 mm side port incision. Just draw, take the flanges centrally and draw it out. Now, you can remove the B.Hex under irrigation. Be mindful to just keep the irrigation enough to keep the anterior chamber formed, not have the iris prolapse. That's the key. And you can, and this is a wonderful technique by Dr. Zain Khatib, where you can just, tumble out the B.Hex after disengaging the flanges. So to summarize, the B.Hex is a simple, safe, affordable device. It's a single plane hexagon with notches and flanges. It's ultra thin. The smallest incision size is actually 1.2 mm and requires 0.9 mm only for removal. Snagging of incision, there is no injector required. And the B.Hex Force, of course, offers a much better control. It's a very short learning curve. Thank you very much, Dr. Chintra, once again.
Dr. Suven, what is that main difficulty a beginner would face when inserting your ring? You have anything to add besides all that you have said?
Beg your pardon? I
What
couldn't
would
get your
be
question. I'm
the
sorry.
main mistake for a beginner when he's trying to insert your ring?
Yeah. I don't see actually, most beginners actually start by just seeing videos. So it's just, it has got, you don't need any, it's not rocket science over there. You just need to hold the flange and take it inside. Now, there is no struggle over there because it's a very thin device. Yes, what we need to do is place the entire device in the entry chamber before we start tucking the flanges. If you leave part of the device in the incision, then tucking might be a bit difficult and the flanges can get untucked.
Yes. Kamil, can you take the next question?
Yes, ma'am. Dr. Suven, any challenges if you're going to insert the B.Hex ring in the middle of the phaco, if you're going to experience meiosis or?
No. Actually, since this was 4 minutes, I didn't cover that part. It's actually the safest device with the in the presence of a capsulorhexis. So
Okay.
because you can see as you engage the flanges, you can see the engagement and you can draw the flanges towards the periphery. And if you face any resistance, you know you've engaged the capsulorhexis. Whereas in a device like a Mulligan ring, the opening is on the side and you really can't see it. Here the notches are open and facing you. And every time you push it to the periphery after tucking it, you are having instant confirmation that you have not engaged the capsulorhexis. So it's very safe.
Dr. Meenu, if we are going to use iris hooks and the pupil is small, so what, and you are halfway through the phaco as Tamil said, so then how would you, what would be the first thing you would do?
You mean during phaco, pupil becomes small and I want to put iris hooks?
Iris hook, yeah.
Iris hooks. Iris hooks is also safely done. Only thing is we should remember that the rhexis is beyond the pupillary margin. And when you're hooking, you can hook the rhexis margin also. So what I do is I put viscoelastic first, elevate one area where the first hook is going to be placed, and then hook the iris and lift it up and see and pull. And then you will see the bag moving if you have engaged the rhexis also. And if it is freely moving, elevate and pull. And then go get it beyond the rhexis margin. Once it is beyond the rhexis margin, the next one can be just taken towards the first one and then sweep it along so that you are off from the rhexis margin. So that is the easiest way to cover this off. One small thing is when the beginners, for the beginner, when holding on to the segment which has rings, three rings. I have seen people holding that and struggling to engage the other segment. So these are things we may not expect, but these are things which can happen. So it is ideally you hold on to the segment which has the three rings on the center of it and tuck that in, and those things have to go in. Even the other part can also go underneath if you catch that. But these rings are for holding and tucking them underneath. And you can either tuck one side of the flange and then tuck the second side. But later on, you can go with one go and tilt on one side and get one in, and tilt on the other side and get one inside. So that is the technical.
There's just a little bit of supination and pronation which is there, and you need to hold those tabs. Just to add to what Meenu said about iris hooks, what I do is if I am using iris hook and in a myosi, which I actually rarely use iris hooks, but if I do use, I can use a second instrument from the other side port and tent up the iris, tent up the pupil margin, and then use the iris hook. That way you are absolutely sure you not engage the capsulorhexis margin. Use a second instrument from the other diametrically opposite side and tent up the iris.
Yeah. Srish, how would your incisions differ when you're making a side port, whereas it's an incision for an iris hook? Anything different you have people, attendees to tell?
I usually make 4 side port incisions. It should be at the limbus. If you go more into the cornea, you are going to tent up the iris, so that is not good. And so it should be very close to the limbus.
I think it should be a stab incision if it's to be for the iris hooks, as against a small tunnel incision for a side port.
Yeah.
And the other practical question which we could ask is, Tamil, can you take the question? if you have to, the pupil is very small and you want to make a larger rhexis, this is a very simple question, but any of you, Naren, could you tell? You want to make your rhexis and the pupil is small, you want a larger rhexis. And besides iris hook, what else would you do?
I think any of the pupil expanders, whichever the surgeon is comfortable, they can use, ma'am. And then if it is definitely too small of a pupil and you need to, create a very good or normal size rhexis, you need to use one of the pupil expanders. Once you have good exposure, then do your rhexis. And one more tip on if at all you have completed your rhexis and then the pupil becomes small and then you're not sure on how to do. At that point, ideally, it's better to avoid iris hooks. One more option is to use the capsular hooks. Capsular hooks can act as both. If at all the capsule gets nicked, nothing happens. And plus, it can pull your iris too. So that way, you're safe now.
Okay, thank you.
Madam,
So
your question was how to do a rhexis under a small pupil without the expansion device, is it not? So
yes.
that was what I understood. So we can use a Y hook or a Kugler's hook to
Yes.
retract off the iris wherever the leading part of your rhexis is, and visualize those areas where you are tearing, and also continue and complete the capsule rhexis.
And in the first step itself, ensure that the Trifan blue goes right deep into the under the pupil also, so that it's stained also.